What is Original Medicare? Well, by the end of this video, you'll understand exactly how Medicare works so that you can enroll with confidence. Hi there, I'm Esther Kim, licensed independent agent and your Medicare lady. For the best Medicare advice, subscribe to my YouTube channel and hit that notification bell so that you'll be notified when I post a new video. Now, let's jump right in. So what is Original Medicare? Medicare was enacted in 1965 under President Lyndon B. Johnson. It is a federal health insurance program for U.S. citizens as well as permanent legal residents. Medicare is the largest healthcare payer in the United States. Matter of fact, it covers over 60 million people. Now, you become eligible for Medicare when you turn 65. However, you may also become eligible for Medicare before you turn 65 with certain qualifying disabilities and medical conditions. Medicare offers basic health insurance coverage. Therefore, it helps pay for things such as doctor and emergency room visits, outpatient procedures, and hospital stays. The Center for Medicare and Medicaid Services governs both Medicare and Medicaid. They're also referred to as CMS. CMS is a branch of the Department of Health and Human Services. Original Medicare, also known as Traditional Medicare, is made up of two parts. Part A, which is hospital insurance, and Part B, which is your medical insurance. I'll break down these parts here in a few seconds, but first let's discuss how Medicare is funded. According to CMS, total Medicare expenditures for 2017 totaled $705.9 billion. Now, this is funded through two U.S. Treasury trust funds. The first one is the Hospital Insurance Trust Fund. It funds Part A as well as Medicare Program Administration. This trust is funded by payroll taxes, income taxes paid on Social Security benefits, interest earned on the fund's investments, and Part A premiums for those that don't qualify for free Part A. The second trust is the Supplementary Medical Insurance Trust Fund. This funds Medicare Part B, Medicare Part D, and Program Administration. Now, this trust is funded mostly by Part B and Part D premiums, funds that Congress authorizes, and trust fund earned interest. Now, let's look at the parts of Original Medicare. As previously mentioned, Medicare is made up of two parts, Medicare Part A and Medicare Part B. Medicare Part A is hospital insurance. It covers inpatient hospital stays, skilled nursing facilities, hospice care, and some home health care. If you or your spouse pay into Social Security taxes for at least 40 quarters, then you will not have to pay a premium for Medicare Part A. But what if you're a U.S. citizen or a permanent legal resident and you do not meet this criteria? Well, you may still be able to enroll in Medicare Part A, but you'll likely pay a premium. I'll save details for this for another video, but just know for now that most people will not have to pay a premium for Medicare Part A. Now, let's talk about how Medicare Part A coverage works. If you're in a hospital for 1 to 60 days in 2020, you will pay a deductible of $1,408. Now, it's also important to note that if you have multiple hospital stays throughout the year, then you may have to pay this deductible each time. If you reach days 61 through 90 in the hospital in 2020, you will pay a copay of $352 per day. Furthermore, for days 91 through 150, for the year 2020, you'll pay a copay of $704 per day. Now, I keep mentioning 2020 because these copays and deductibles can and often do change every year. So it's important to make sure that you check each year to see what copays and deductibles you may be facing for that year. For skilled nursing confinement, there is no copay for days 1 through 20. Beyond day 20, you will pay a copay of $176 for each day that you stay past day 20. Now let's move on to Medicare Part B. Medicare Part B, also known as medical insurance, is the part of your Medicare insurance plan that covers services related to doctor visits, outpatient care and procedures, diagnostic screenings, medications the doctors administer themselves, blood, lab tests, second opinions, medically necessary services, preventative services, ambulance services, mental health services, clinical research, medically necessary supplies, some durable medical equipment, physical therapy, and cardiac rehabilitation. Whew, that's a lot of stuff. But easy rule of thumb that I like to tell seniors is that Part A covers the places like the hospitals, and Part B covers the people like the doctors. I think it's worth noting here that restrictions may and do apply. So it's important to check with your provider or check directly with Medicare to make sure that the treatment that you're facing is covered. Now, Medicare Part B does have a premium set by the federal government, which for most people in 2020 is $144.60 per month. If you are drawing Social Security, this premium will be deducted from your Social Security. Otherwise, you'll be billed for it. In addition to this, if your income is above $87,000 in 2020, you may have to pay a higher premium called an IRMA, which stands for Income Related Monthly Adjustment Amount. This IRMA is based off of your income from 2 years prior. For more information on the IRMA based on your income bracket, you can go to Medicare.gov. I'll put a link in the description below for you to reference. If you have creditable coverage, for example through an employer plan, veterans benefits, or union benefits, it may be beneficial for you to delay enrolling into Part B. You just want to check and make extra sure that it is creditable coverage. The reason for this is because if you delay enrolling into Part B and you don't have creditable coverage, you may face a late enrollment penalty later on when you do decide to enroll into Medicare Part B. If you're not sure and you wish to check to see if your coverage is creditable, you can do so by reaching out to your plan administrator. Part B has an annual deductible of $198. When the deductible is met, Medicare pays 80% and then you pay 20% of the Medicare approved cost. Unfortunately, there is no limit on this cost. However, there are additional insurance plan options available to help cover these additional costs. And that's where an independent agent like myself can help you by going over these different coverage options and helping you choose the right coverage based on your individual needs. If a provider is on Medicare assignment, they agree to accept the Medicare approved amount as full payment for the services provided. In contrast, if a provider is not on Medicare assignment, they can charge an excess charge of up to 15% in addition to the Medicare approved amount. Now, I do want to point out here that most doctors in the United States are in fact on Medicare assignment, so don't let this excess charge scare you. I just want to make sure that you understand what an excess charge is and that it does in fact exist. So Part A and Part B are the two parts of Original Medicare, but what about Part C and Part D? You may have heard of these by now. Well, Part C and Part D are actually not parts of Original Medicare. They are optional parts of Medicare. However, you will most likely want to choose a Part C or Part D plan in order to avoid having to pay a Part D late enrollment penalty. Now again, we're going to save that conversation for another video because I know this is already a lot to take in. But just to give you a brief overview, Part C, also known as Medicare Advantage plans, refers to a private form of insurance that you can enroll in. Part C replaces your Original Medicare. Now, by law, Part C must cover at least what Original Medicare covers. And Part C plans are usually HMO or PPO plans that have networks. Part C may also include prescription drug plans, which many of them do. They may also have additional benefits built in. Part D refers to a standalone prescription drug plan. Original Medicare doesn't cover most prescription drugs, so if you stay on Original Medicare, you'll likely want to enroll in a Part D plan. Now, if you go this route, you can pair it with a Medicare supplement plan to help you cover your Medicare claims that Original Medicare doesn't pay. And again, I'm going to cover all of this in another video. I don't want to overwhelm you with too much information, but I do want to give you a general overview of your coverage options. So let's go ahead and move on. So when can I enroll in Original Medicare? You become eligible for Medicare when you turn 65 or are not yet 65 but have a qualifying disability or medical condition. According to the 2020 Medicare New Guidebook, that is the official government handbook for Medicare, you'll be automatically enrolled in Medicare Part A and Medicare Part B if you're already receiving benefits from Social Security or the Railroad Retirement Board, you're under 65 with a disability, or if you have ALS, also known as Lou Gehrig's disease. For everyone else, you'll need to sign up in order to receive your Medicare benefits. You can sign up during one of the enrollment periods. When will my Medicare coverage start? If you sign up for Medicare before the month of your 65th birthday, your coverage will usually begin on the first of the month of your 65th birthday. This is also true if you're automatically enrolled into Medicare. The only exception is if you have a birthday that lands on the first of the month. If that's the case, then your coverage will actually begin the month before the month that you turn 65. So let me give you an example of this. Let's say Gary's birthday is on September 12th, and that's when he turns 65. Well, if that's the case, his Medicare coverage will start on September 1st. But then we have Sarah, whose birthday is on September 1st, and she turns 65 this year as well. Well, because her birthday falls on the first of the month, her coverage will begin on August 1st. Now, I don't know why Medicare chose to do it this way, but it is what it is. So now you should have a pretty good understanding of what Original Medicare is and how it works, and hopefully you'll be able to go ahead and enroll with confidence. But what about your additional coverage options? After all, nobody likes being stuck with that 20% of the bill that Medicare doesn't cover. Well, in my next video, I'll discuss your different coverage options and how you can choose the right coverage based on your situation. So make sure you go ahead and subscribe to my channel so that you'll be notified of when my next video is posted. Do you have questions about this and other Medicare related topics? You can call me at 808-650-5939 or toll free at 1-800-575-9808 to set up a phone call. And I'll walk you through your enrollment process, all of your coverage options, and help you choose a plan that's best for you based on your individual needs. I'm located in Honolulu, Hawaii, but licensed in multiple states, and my services are 100% free of charge. So don't hesitate to call me if you need help. You can also schedule an appointment directly in my calendar using my Calendly link, which I'll include in the description below. If this information was helpful to you, please give this video a thumbs up and go ahead and subscribe to my channel so that you'll receive the latest information regarding your Medicare coverage. Thank you all so much for watching. Again, my name is Esther Kim, licensed independent insurance agent and your Medicare lady, and I'll see you all next time. Bye everyone!